Hi, my name is Danette Reese McGee. This is week 9 in nursing 640D. I'm presenting this week a SOAP note on the patient with abnormal uterine bleeding. So, as you know, ATE is a 42-year-old female who presents because she has been experiencing painful menstrual bleeding and bleeding between her periods for the past 3 months. The information I gathered is her LNP started this morning, 7/4/2019. She states that her cycles are regular and come once a month. Her cycle normally lasts about 4 days, but for the past 3 months, she's been spotting bright red blood in between and must wear a panty liner. During her cycle, she has to change her tampons about every 4 hours. The first 2 days of her cycle is usually painful, but then gradually gets better. She states that the pain is in her abdomen and feels crampy. She has taken ibuprofen 400 milligrams with some relief of the symptoms. She says nothing actually makes it worse. She states that on a scale of 0 to 10, with 10 being the worst, most of the times she rates it an 8. AD denies pains other than when her normal cycles are happening. AD denies any nausea, vomiting, fever, shortness of breath, weakness, fatigue, or dyspnea. In my review of symptoms, she denies any significant medical history. She denies any surgical history, denies significant maternal, obstetrical, gynecological, or medical history, or prenatal and medical history. She's a G2, P2. She had 2 full-term pregnancies, and she reports no complications with those pregnancies. She's not on any medication presently. She does not use any contraception, and she states that her husband has had a vasectomy. She also denies condom use presently also. Denies past or present history of smoking, alcohol use, and she doesn't use any kind of illicit drugs. Her last PAP and STI testings were about a year ago, and her last mammogram was also about 1 year ago. She has never had an abnormal PAP, never had any STIs or an abnormal mammogram, and she has no known allergies. So as far as the physical history, she's alert, friendly, well-dressed. Her vital signs were within normal range. BMI of 31.8, which is considered obese. Cardiovascular, no heaves, lifts, tenderness, no murmurs or extra sounds. Respiratory, no labor, breathing, chest expansion, symmetrical, breath sounds, clear. Abdominal was flat, symmetrical, with no visible masses, striae, scars, or lesions. Bowel sounds are present in all 4 quadrants, no bruits. Abdomen soft, non-tender, and no masses. Genitourinary, no bladder tenderness upon palpation. No distension, external genitalia normal, no lacerations. Vagina looks healthy, has pink mucosa, no discharge noted, normal rugae. Cervix has no lesions, menstrual discharge noted. Negative cervical motion tenderness, uterus and ovaries normal size, normal non-tender, no masses. Adnexa, anus, and perineum intact. No lesions, fistulas, or hemorrhoids. Neurological. She's alert and oriented ×3, responds appropriately. Labs. For this patient, differential diagnosis I came up with was endometrial cancer, and then fibroids could be a possibility. So appropriate labs for this patient would be a urine pregnancy test, serum ACG, CBC with differentials, CMP, ferritin levels, TSH, TSH, LH, and STIs. Okay, so she is diagnosed with endometrial polyps. So, as far as the plan goes, diagnostic tests were transvaginal ultrasound, in-office endometrial sampling, and the labs were used to diagnose this. Pharmacological, I would suggest that she takes 600 milligrams of ibuprofen peel Q6 hours PRN for the cramping. I would also advise her to take it with food to avoid the GI upset. And non-pharmacological things she can do is she could apply heat to her lower abdomen, and sometimes that's effective in reducing the pain. I would educate her about endometrial polyps and the treatment for it. Endometrial polyps are one of the most common causes of genital bleeding in women. They are hypoplastic overgrowths of the endometrial glands and stroma that form a projection from the lining of the uterus. Most polyps are benign but can be malignant. The treatment of choice is a polyectomy performed under histoscope. And it provides relief of symptoms, and it can diagnose or rule out malignancy. I would refer her to the OB/GYN for this procedure and for further evaluation. I would ask her to follow up with the OB/GYN for treatment, and then I would ask her to return to the clinic for her scheduled Pap and mammogram and PRN as needed. And that is the end of my presentation for abnormal uterine bleeding. Thank you.